Welcome to NICU Heroes, a podcast produced exclusively for NICU professionals with me, Catherine Whitaker, as your host. I'm the mom of 6 children, including my very own NICU baby. This podcast is produced by Hand to Hold, a national nonprofit dedicated to providing free personalized support, resources, and community before, during, and after a baby's NICU stay. As a NICU professional, you've been well trained to care for the tiniest and the sickest babies every day. While NICU parent scars are not as visible, NICU parents are often as fragile as their babies, requiring patience, guidance, and encouragement to ensure that they are mentally, emotionally, and physically prepared to endure the pressure of a NICU stay. NICU Heroes is dedicated to helping NICU professionals like you better understand, support, and nurture the entire NICU family. Howdy, y'all, and welcome back to the podcast. I have loved bringing you all these conversations with NICU and medical professionals to help you be the best NICU professional that you can possibly be. I think today's topic, I'm guessing, but I think I'm guessing right, is that there has been a point in your career, either currently or in the past, where you have felt burned out and overwhelmed. And I felt like that was something, particularly in the state of the current world that it is in, is that might be something that may resonate with you, and that I wanted to have a conversation with someone that could help you identify why am I burned out? Why am I stressed out? What are some common stressors that I might be overlooking? And then what's the antidote? How do I learn to fall in love with my job again, with my family again, with what it is that I'm doing in life again? And I think this conversation with Dr. Landers is going to do just that. So our topic today is NICU professional burnout. My guest is Dr. Susan Landers. She graduated from Auburn University with bachelor's degrees in biology and in chemistry. She received her MD degree from the Medical University of South Carolina, completed a pediatrics residency at the University of Texas Southwestern Medical School Hospitals, and eventually completed her neonatology fellowship at Baylor College of Medicine. She practiced academic neonatology for 14 years and served on the faculty of 2 medical schools. She conducted clinical research and published 23 peer-reviewed papers and taught medical students, residents, and fellows. She was medical director of the Mother's Milk Bank of Austin and served on the Milk Bank's board of directors. She is an expert in breastfeeding medicine and became a fellow at the Academy of Breastfeeding Medicine. She served on the executive committee of the section on breastfeeding in the American Academy of Pediatrics. And in that capacity, she contributed to policy statements and clinical guidelines and wrote 4 more peer-reviewed publications and a book chapter. Together with her husband, Dr. Philip Berry, she raised 3 children and resides in Austin, Texas. And so with that line of credentials, let's chat. Well, Dr. Landers, I am very excited to have you here because I think what we are going to talk about today is something that every NICU professional listening, and probably every person listening, can identify with, a feeling overwhelmed, burned out, and then how do I balance? And I hesitate to say balance, but how do I integrate work life with family life, with personal life, and make it all work? Because it can sometimes be a challenge. So why don't we start with your background? Because I always feel like it's important to give people an idea of where you're coming from, why this is a topic that you care about so much. So why don't we start there?
Okay. I was a neonatologist and practiced for 34 years in various NICUs, 3 or 4 different NICUs around Texas and one in Arkansas. I loved what I did. I loved taking care of babies and mothers and getting to be a part of their family. I loved working with NICU nurses. I especially miss, now that I'm retired, being part of a team. You know, when you're in the NICU, you don't do anything by yourself. Everybody is part of a big team. And I miss that camaraderie and teamwork, that sense of real accomplishment when everybody pulls together and we see a baby respond to treatment. We see parents settle down and be okay with what's going on in the NICU. So I practiced for a long time. I also raised 3 children during that time, working full time. My husband was a physician, pediatric nephrologist. He didn't work as many hours as I did, not much night call, but he practiced clinical medicine. And so he was a good buffer for me to bounce ideas off of, to help me cope with stress, emotional challenges in the NICU. So we were a good team through all those years. Since I've been retired, I have been writing about burnout in physicians, nurses, even working moms, because after I retired, I wrote a book, a memoir about my life and my NICU stories. And in writing that book, I've talked to a lot of people who say, how did you know it was burnout? How did you feel when you were burned out? What did you do about it? What were the factors that led to it? And so I've had so many questions about my life and my experience that I wanted to write and teach others about that. Unfortunately, Catherine, burnout is an epidemic right now, especially among healthcare workers. NICU nurses are near and dear to my heart. Most of my best friends are NICU nurses.
Mine too.
Yeah. And they were all so supportive of me when I was burned out, and I wanted to sort of give back to this community some of my wisdom. I'm quite a bit older now. I've been retired for 6 years, but I still enjoy talking to people and kind of working through these issues with folks. I think it makes a difference. I think talking about working mother burnout makes a big difference because so many of us suffer in silence. So many of us struggle and think we're alone when in fact lots of people are feeling the same way we are. And so by giving a voice to some of these problems, even though mine was in the past, I hope that I'm allowing other women, other professionals, other working mothers to go, oh, I'm not alone in this. Oh, I understand. This is something I can talk about with my colleagues, with my friends. And so my purpose now is to educate others in ways that we know that are effective in treating and curing burnout.
Well, I'm glad that you mentioned that your husband was also a physician. So while some NICU professionals listening to this may be married to someone in the medical profession, their partner may have either a high demand or a high stress job. So I think that there are some people that can absolutely identify with that, or they're both of them may be working, whatever their careers may be, and they're also raising a family and they're trying to figure out, how do I do my best in the workplace? How do I do my best at home? And how do I do my best in my relationship with my partner? So figuring out how all that sort of blends together. I think
Exactly.
many people can relate to, yes, I have this working spouse. Or if you're the one who works and that's the person that stays home, there's still, that doesn't mean that you get a pass. It's still difficult. You got to manage all that too. So I'm glad that you mentioned that, because I think there are lots of people, while they may not be married to a physician, they may be certainly married to someone who also has a job that requires them to figure out, like, sit down on, one night a week and figure out calendars and, like, how are we going to make all this work this week? So
Exactly. Yeah.
are there, I know you mentioned a little bit about NICU professionals, especially. I know that's where your heart is. I know that's what you really are passionate about. So let's go there, because I think there may be some personal characteristics that maybe moms or NICU professionals may have that maybe make them more susceptible to burnout, overwhelm, those sorts of things. So let's
Right.
chat about that a little bit.
Yeah. NICU professionals tend to be lovers of children, but also lovers of critical care and action and things that happen fast. My daughter is a pediatric ICU nurse, so I think that she's sort of got the bug from her dad and me. NICU professionals, whether they're doctors, nurses, respiratory therapists, they tend to be overachievers. They tend to be the best in their groups. Many are perfectionistic. They love details. They love having things sorted and collated in a way that makes sense. But they also are very empathetic. You can't work in the NICU and not feel for the mom that's having a bad time, not feel for the family that's not tolerating all the stress well. And so it is this compassion, this empathy, this overachieving, if you will, that sets some of us up for burnout. If you're a perfectionist, you really want everything to work out. You don't want a complication in your baby. You don't want to see someone struggling and languishing and in the hospital for 6 months. It's heartbreaking. So whether it is how we're wired, whether it is how we work in the NICU, in the critical care unit, whether it is how we see ourselves in the faces of parents who are going through such a huge trauma. I think all of those things contribute to our susceptibility to burnout. It's hard to be strong and do all that. It really takes a lot out of you. And many of us are capable of giving it. We love it. We like going to work. We like starting IVs in 600-gram babies. We like putting chest tubes in. I mean, those kind of things are really fun and exciting, but they're also very stressful. And sometimes we lose track of how much stress exactly that we think we can tolerate.
So you're saying like the passion for the job sometimes masks your ability to recognize when you've reached the end, and maybe you're not realizing that you've reached the end until you're at the end.
Yes, it did
That
for
makes
me.
sense.
And I think for a lot of the nurses and nurse practitioners that I've talked to, a couple of my partners never seemed to be as emotionally stressed as me. And I would ask them why that was. And every one of them said, my wife takes care of everything. And so I think for single parents and for healthcare workers who don't have support at home, that is a crucial part of burnout as well. We don't leave our children at home when we go to work in the NICU. If we have a problem child or a child with going through some big challenge at school or with their health, it's in the back of our mind. And then we're taking care of this critically ill kid. And so how do you juggle that emotionally? And so I think that for people who are single parents, I think that people who don't have a supportive partner, one who doesn't have a stressful job, who may not understand the challenges of medicine and the ethics in the NICU, it would be harder to fend off burnout. And those folks may be more susceptible. I remember talking to a nurse, one of my favorite nurses, Mandy, and about being stressed. And I said, what's your husband do for a living? She said, well, he's not as stressed as me. He's a policeman. I went, what? And she said, I swear, he's not nearly as stressed as me. I said, well, who does most of the childcare? She had 3 daughters. She said, oh, me, of course. And who does all the cooking? Oh, me. And who does all the, and the list goes on. And even though her husband had a very stressful job, she registered her stress greater because of everything else she was doing besides being a really fantastic NICU nurse.
Right. Well, it is. I'm listening to you say that, and I'm like, I felt some of those things as the perfectionist NICU mom in the NICU. So
Yes.
I think that we sort of feed off each other. I think sometimes we don't realize, how far we've gone down the burnout scale until we look up one day and we're like, everything's burning down. And how did that happen? So maybe let's identify, like, what are some things, Dr. Landers, that would indicate, okay, you are on the path to really feeling overwhelmed, stressed out, and we need to either pull back or we need to take a pause. So I know that there's some obvious things, but there might also be some other things that people hear and they're like, oh, I hadn't thought that might be a sign that I might be in over my head.
Yes. Well, the first one and the easiest one to identify is being overextended, working too many hours, having an inflexible schedule, a lot of night call. I mean, some people really like working nights, but most people don't like working nights and juggling, going to days back and forth. So your schedule, your work schedule, your number of hours worked matters a great deal, because that is the direct cause of physical exhaustion. Then there is what you do at work. Are you taking care of the sickest babies? Are you taking care of the case where the parents and the doctors disagree about what's appropriate? Lots of ethical issues, lots of conflict. Those provide emotional exhaustion. We can only do so much with our empathy and our compassion for our patients and their parents in the face of conflict. That's the hardest. So if you're working too many hours and you're taking care of the sickest patients that have big issues surrounding their care, those are big red flags that folks should look out for, how the job affects them. The next thing to look for is whether or not you really get into your work. Do you like your coworkers? Do you talk to the parents? Do you ask questions on rounds? Do you feel like you are part of a team? That's personalization. That is being part of work that is valuable. And in burnout, you feel depersonalized. You detach from your work. You don't want to talk to folks. You don't care what other people think. When I was my worst burned out, I would go in the call room after everything was done at night, and I would literally hide. I used to love to walk around the unit, talk to parents and talk to the nurses and find out what was going on, and, just be around. And then when I was burned out, it was like I was literally walling myself off from all of that. I didn't want to feel it. I didn't want to see it or notice it. So depersonalization and then cynicism is a real red flag for burnout. When you become so cynical that you think, oh, whatever I am doing does not make any difference. Who gives a flip? Why bother? My supervisor doesn't care about me. This hospital doesn't care about their nurses. This manager really won't listen to me, and I don't feel appreciated. Those things are also red flags for depersonalization, because as humans, we tend to detach when we're not feeling worthwhile, when we're not feeling part of a team, when we're not feeling like we're making a difference. And that is the final aspect of burnout that hits you in the face in a way that is truly remarkable. When you dread going to work, when you feel like you can no longer make a difference, when you feel like you're just going through the motions, when you think, what difference does it make? Why am I even here? That is the final nail in the coffin of burnout. So it starts with physical and emotional exhaustion. It progresses generally to depersonalization and cynicism. And when folks feel like they have no agency, like they're not effective, like they're not making a difference, that all those things together is clinical burnout. And clinical burnout is mainly a workplace phenomenon. And nurses and doctors have carried the brunt of clinical burnout this last decade, especially. And it accelerated, of course, during the pandemic. That's not to say that other workers can't get burnout, that working moms can't be burnout for slightly different reasons, that lawyers and accountants can't be burnout. But for healthcare workers, Because we have so much compassion for our patients. We wouldn't go into medicine and nursing if we didn't have compassion. Because we have so much compassion, we really give a lot of ourselves to our work. It matters to us if we do a good job, if we're part of a good team. It matters to us that patient outcomes are good. It matters to us when a complication arises. We don't want it to happen, and God forbid that it should be our fault. But when we're burnt out, we don't work as well. I already said we dread going to work, and we don't talk and exchange with our coworkers because we're depersonalized and detached. And then we may just be going through the motions. And you can't practice medicine or nursing going through the motions. So
It doesn't work that way.
We are at a greater risk of injury, this thing called burnout, because of what we do. During the pandemic, there were lots of things written about, and people spoke about moral injury. And I think this is very pertinent for NICU because there are so many issues about living and dying, about quality of life, about end of life care. And those issues sometimes in our minds create moral injury. How is this baby going to live? How is this family going to manage? Why can't we do something that helps this kid get better? He can't grow new lungs. What are we going to do to manage while we're waiting for years and years for his lungs to grow? So the moral injury during the pandemic, patients were dying all over the place. There were not enough beds. There were not enough nurses. People were upset. If a patient was dying without their spouse, without their children, that was tragic. And the nurses at the bedside felt this. NICU nurses know very well what it feels like to be with a family who is unfortunately losing their loved one. It's a very intimate, very special time. And when we experience those times, it's also very tragic, and it weighs on our hearts and in our minds. And that can sometimes feel like moral injury. When a child dies that you wished would live, when a child lives and suffers and you might have wished that that child had died, because that does occur in the NICU. There are conversations about kids who have very little hope of recovery, and nurses and doctors will say to each other, it would be so much better if that poor kid just died. And so God forbid that we think that, but it does come up. We do see patients who are so unresponsive to treatment, but for whom treatment continues and continues and continues, that it becomes to us sometimes moral injury. And anytime there are ethical issues and conflicts or moral injury situations and that sort of weighty decision-making in the NICU, that sets us up for burnout.
Well, it seems like, and this may not be true. I mean, I'm thinking about, I don't want to diss accountants or anything like that, but it's easier for y'all to take your work home than it is for you to put a hard stop at the door, right? Because you've got these feeling hearts and you can't just turn it off. Like if a baby has just coded and that was at the end of your shift and then you go home, but someone is still taking care of, you're still invested in that family and in that baby, but yet you have to come home and you have to feed your family and you have to love your spouse. And then you go back to the NICU and you enter it again. So it's almost like there's this continuation of the job that never really leaves you. And so being able, I think, to find a way to navigate that must be incredibly difficult. There was one thing that you said before we dive into we talked about the hardness of it and then what do we do to combat it. But there was one thing that you said that I think is worth mentioning is that you were talking about this empathetic nature that it sort of cost you something. In other words, when you're in that role and you're in that position and you're loving your patients, you're being present for them, it costs you something. And I think when you're in a healthy place, you can decide, yes, this is a cost that's worth it. I love my patients. I love this team that I work with. I love what it is I do. But when you were in a burned out situation, that cost becomes very high because you're not able to come back from that. At least that's what I heard from you, is
Right.
that, and that it's difficult to do that. Dr. Landers, I guess my question to you is, before we go into what the antidote is to burnout, did you ever find an opportunity when you saw a NICU professional who was burned out, who was sort of at the end, and you were in a good, healthy place? Did you ever go to them and say, hey, I'm seeing some things and I'm concerned about you and let's see how we can get you help? Or did you leave that to the nurse manager? I guess I'm trying to give people who are listening an idea. Like if you
Right.
were in a good, healthy place and you see someone who's struggling and y'all are in a similar position, do you throw them a lifeline? What do you do in that
Yes, you
situation?
do. You absolutely do. And anybody who works in teams knows that making sure everybody on the team is okay is a crucial part. If somebody was acting off or somebody was acting down, or I heard somebody say she's always late or she never does a good enough job, and then I would go and try to find out what that nurse was doing and what was going on in her life. If one of my partners was always grumpy or always late or always kind of cynical on checkout rounds, sometimes I would pull them aside and say, what's going on? And they may or may not want to talk. I think women nurses and women physicians like to talk about their feelings a lot more than men do. But I did have a male partner that I talked to one day and said, what's going on with you? You don't seem the same. And he said, my wife and I are having trouble. We've been on a few trips. We've taken vacations. It's not working. I'm really sad about what's the future's going to bring. And I said, that's totally reasonable. You can't keep a difficult marriage off your shoulders while you're in the middle of work. And you can't keep taking care of a really difficult patient off your shoulders when you're going home trying to deal with marital tension or financial troubles. So yes, I did have opportunities to talk to people, to ask questions, but that's kind of my style anyway. How are you doing? That was great. I saw you did a really good job. I like to give people pats on the back. I learned pretty early in my career that giving people pats on the back was just as important as saying, are you okay? Because, I mean, they're both important and they do different things. Getting somebody a pat on the back, saying that was a great job you did. I love the way you handle that code, really makes people feel fulfilled and wonderful and like they're recognized. And asking somebody how they're feeling is more of a human connection that we maybe don't do enough in the workplace. So for nurses listening to this, talking to your peers is huge. Asking your peers how they're feeling in the lounge. What's going on? How are you? Maybe one-on-one with a coffee break is better than in the lounge where you're within earshot
For
of
group
other
therapy,
people.
right? Yeah. Sometimes
Yeah.
people respond better one-on-one.
Yeah. Having a general complaining session where there are lots of people around, and then whoever didn't speak, maybe talk to them afterwards, because sometimes that's a sign that there's something underneath the surface. I would go to the nurse manager and I would say, I can remember two instances, one at Houston and one in Austin, where I went to the nurse manager and said, I'm really worried about so-and-so. She's just not acting like herself. She's just not as sharp as she was. I'm worried that I don't know if she's drinking or things aren't good at home or what's going on. So would you talk to her? Would you find out what's going on? And so that is always an option to, if you're a manager, talking to the worker, if you're a coworker, going to your manager in confidentiality, in a confidential way, and saying, I'm worried about this person. I like this person, and he or she does a good job, and I'm worried about why they're not on their game right now. That's definitely something you can do.
Right.
But most people like to talk to other people about their feelings. And I think even with my male partners, I would say, are you bothered by so-and-so? And they would say, nah, it doesn't bother me. Or they would say, yeah, I don't like it. I don't like that kind of case. It kind of bothers me. And I would try to get them to talk about it. But I think men are more hesitant to talk about their feelings. Maybe neonatologists and maybe NICU nurses that are men are softer because they're taking care of babies and mothers and families. But I think the best thing we can do for our coworkers is to ask them how they're doing, is to talk with them, is to try to get them to open up about what's going on, whether it's in the unit, whether it's a conflict within the team, whether it's moral injury with their patient, whether it's something they're bringing from home. By asking and by listening, you're giving them an opportunity to kind of make sense of what it may be that's affecting their work.
Right. No, I mean, we were blessed to have both men and women NICU nurses as well as neonatologists, and I found them all to be equally compassionate in a different way. I always felt like in just the moment that I needed, and so I think it's a unique breed of NICU professionals. There is an empathy already built in when you
Yes.
arrive at the door, and I was grateful for that. Yeah, my husband he calls it his pat on the back file. I was glad that you mentioned that. So he started keeping notes, like when someone would say something and started writing it down, and I always found that to be really helpful. Also had a great friend, and he would always say, like, "How are you doing?" And then he would pause and he would look at me and say, "Really? How are you
How are you
doing?
really doing? Right.
How are you really doing?" And so that I think that gave me permission because our reflex is to say, "Oh, I'm fine," or "Oh," or to gloss it over. "Oh, it's not that bad." But when they say, "But really," and then that sort of gave me the permission to say, "Well, actually, this is what's going on." So maybe you're giving someone permission to tell you what's really going on. So I know we talked a little bit about the things that might lead to burnout. What are like some common stressors, Dr. Landers, that people might overlook that might sort of lead to burnout and overwhelm?
Something going on with your children. That's a problem. Some health issue, some learning issue, something at school, your child's being bullied, they don't like their teacher, they're in a situation with peers, middle school or high school, and things aren't going well. God, today with all the social media and cyberbullying, I don't know how parents are dealing with it other than staying on top
One
of
day at a time, Dr. Landers, one day at a time.
staying
That's
on
how we're doing
top
it.
of what they're looking at and what they're scrolling through, but being with them and knowing what they're doing. And that's so important. But we all carry that with us. Men too. They might not worry about kids as much as women do because I think it's more of a female thing to worry about children. And my husband never worried when I was worried about our kids. I don't know why. He's a
My husband
pediatrician.
he typically will say, "Well, you worry enough for the both of us." And
Right.
I was like, "Thanks."
Probably.
Yeah.
There you go. Yeah. So things going on with our kids, things going on with their schooling, with their education, things going on in the marriage. If your marriage is not healthy, if you don't have a partner to bounce things off of, that's stress. Of course, financial stress. And nowadays, folks are more financially strained. Those things, they sort of needle at us. I mean, I don't think in the middle of the NICU taking care of patients, I would worry about, oh, how are we going to make the mortgage payment? But you do put it somewhere in your brain. I'm worried about finances. And so that's something that plays into it. For me personally, as I got older, my older parents were a real pain. They were in Florida. Here I was in Texas. I had 24-hour nannies. Well, not nannies, but caregivers, a cook, a driver, a caregiver. And of course, it accelerated as they got older. They lived to be 94 and 97. And for the last decade of their life, I talked on the phone to caregivers. I talked on the phone to their doctors. I drove over to Pensacola, Florida to meet with care teams. I oversaw all their finances. Of course, I'm the oldest daughter in the family.
I was getting ready to say, you must be the oldest. Yeah.
And it always falls to the oldest daughter in the family. So those of you who are thinking about elder parents and you're in this situation, please give your brothers something to do. It is a huge emotional burden to worry about older parents and who's going to pay for their care and where's the money coming from and who's coming to take care of them and what happens at 2 a.m. when mom slips and falls and breaks her hip again. And oh my God, I mean, the challenges are endless. And I think we have not begun to talk enough about how millennials are going to feel dealing with aging baby boomers. And I say that based on my own experience. So my two were silent generation, old. They've both been gone now about 10 years. It was a huge strain, huge strain. I mean, I would get calls from work. My sister died when she was in her 50s, and she left a teenage daughter who was raised by her father. They had been estranged, my sister and her husband. But my sister wanted her daughter to be raised by her father. That was fine. I respected that. He called me every day for 3 years to ask for advice about raising this 14-year-old child. He didn't know how to raise a teenager. And I swear I talked to that man on the phone every day. And that was a stress. And sometimes I would fly over there to South Carolina to visit them and to make sure she was okay. And, NICU nurses and doctors are such caregivers, and we're such overachievers in general that we want to help. We want to take care of others. We want to participate in our family issues. I didn't have to go do that with my brother-in-law. I didn't have to do all that with my parents. I just happily took it on like a good little overworking perfectionistic neonatologist.
But it's interesting that you say that, because I think sometimes we tend to default, whether it be medical issues with our own children or with our aging parents or even with someone in our own family, we sort of become everyone's default. Oh, that's what you do in your daily job. So can you just also do it outside of that?
And we're good at it.
You are good at it.
We know how to be patient advocates. We're really good at it. We're not scared to talk to the doctor or the hospital administrator or the insurance company. And that's a good skill set to have, but it doesn't mean we're the only person who can do it.
Right.
And we have to ask our brothers, and we have to ask other members of the family to help. Right. I remember saying to my brother, I'm not selling their house. It'll sit there. I said, Ted, you do it. He said, okay. I mean,
You're like, oh, if it was just easy to delegate. Right. Yeah. No, those are good. Those are good reminders that some of the stressors that we think, as I'm hearing you say those are all stressors that I think every person has. They are magnified, I think, when you become the default or the go-to person, and certainly maybe ones that we might overlook. We might just say, oh, well, that's life. I'm dealing with that, not realizing that that's adding to, we kind of listed out the things that you get in general in the medical profession when it comes to burnout. But then you add all these life things. Right. I should spell that. I'm a Texan, Life, all these life things
exactly.
that start to build and mount. So I know we spent a good amount of time sort of talking about what is burnout, what are some stressors. Dr. Landers, now that we sort of shift into, let's give some people some good news, like what are some things that when you start to recognize, okay, these are some stressors in my life, these are some symptoms that I'm seeing in my workplace environment, I want to do better. I want to be, a better, healthier human, but I also want to be a better medical professional. How do you dig out of that? So what are some things that people can do to combat that?
There are definite strategies that we can use, and it starts with your schedule, working fewer hours, somehow taking a break, somehow getting a schedule that works for you. Whether you have a 3-day weekend, whether you say, I'm so fried, I need 2 weeks off, I'll take my PTO, I've got to sit and think. You have to distance yourself from the unit, from the job, from those really sick babies that you love and those moms that you love. And you have to let your manager know that you need this time. Burnout is a medical diagnosis, and many people will have employee benefits for PTO for burnout. And if you don't know if you have them, you should go ask, because nowadays it's okay to say, I need a week or I need 2
Right.
weeks. And then before you come back, you say to your manager, I've got to change my schedule. I've got to have some flexible scheduling so that I can take care of this child because my husband is doing this. And so the work schedule, the hours at work, is the first thing you change. For me, I just said, I can't do it. I want to go part-time. And I cut my hours back to 35 a week. And that felt like a walk in the park to me. And I was doing night call 1 night a week instead of 2 or 3. And that felt, okay, that's fine. I can do that. The second thing you do
I'm going
is
to pause you real
things.
quick. Do you think that sometimes people might feel guilty for asking for a schedule change because they're worried that they might burden some of their coworkers?
Yes, of course.
Okay.
Yeah, they do. And there's no way around that if you're short staffed in your
Sure.
unit. I mean, the answer is to get adequate staffing in the unit and for your manager to understand and value you and give you this time and say, we can deal without you for a while and we'll all manage because we want you to come back.
Right. Okay. I just
Um,
wanted to mention that. I felt like that was important. All right.
right.
So schedule's the first thing.
Right. The second thing is things that make you feel better. Not drinking wine, not bitching with your friends, like maybe exercise, take a walk, go in nature. I never did learn to meditate effectively, but I started journaling and that helped a great deal. I called old friends and said, I really need to have lunch and sit and talk and laugh. And we did that. And it was so uplifting. I had forgotten how much fun it was to chat and laugh and tell stories. And, with the NICU nurse practitioners, it's always stories about this mom or this baby or this doc or whatever, but it was still fun to talk. And so taking care of yourself, whether it's through exercise, reconnecting in nature, alone time outside, reconnecting with friends, those things helped me a great deal. The other thing that helped me a lot was professional therapy. And I'm the first to admit, I know a lot of people won't admit this, that psychotherapy is beneficial when you're burned out. You can talk to a coach that might be just as effective, but a psychotherapist, even short term, can help you figure out what are the issues. Is it family? Is it work? Is it spouse? Is it all of the above? And that person, social worker, psychologist, psychiatrist, that person can help you pinpoint where the agony is coming from. For me, it was work hours and emotional burden. It was some of those difficult ethical issues and conflicts between docs and parents. And my therapist helped me figure that out. And I was doing things that felt good: exercise, journaling, talking with friends. Alcohol is a very bad way to deal with burnout for nurses and for doctors. It numbs your feelings. It makes you feel less stressed, but nothing goes away and nothing gets resolved. And so I caution people, when I was very, very stressed in the early year of my burnout, I would come home and drink a glass or two of wine a night, and it did not help. It did not help. Talking to my husband helped a whole lot more. So unloading what the stressors are, getting them out, talking to others, taking care of yourself are huge ways to get better quickly.
I will also say I'm grateful that you mentioned therapy. I think maybe 15 years ago or so when we were in the NICU, it was sort of a taboo subject. No one really wanted to talk about it because can't you just figure it out on your own and power through it? Thankfully, I think society has shifted in the sense that it's okay to talk about the fact that you've gone to professional therapy. My husband and I did the same thing. We went to marriage counseling after our NICU stay, and it changed the trajectory of our marriage. So I believe that all those things that you mentioned, we started eating better. We started taking care of ourselves physically, all those things in addition to therapy really did and can, I think, change the trajectory of a career, of a home life, of a marriage. So glad that you mentioned that. I don't think it's as taboo to say it. And I think it
Good.
helps when other people hear, oh, that doctor or, oh, that nurse that I respect did that, which means that might be that it's okay for me to do that too.
Yeah, thank you for emphasizing that. I think there's nothing to lose and everything to
Right.
gain
Right.
from therapy, and it may be covered by your health plan.
Yes, I
And
was
it
going to
may
mention that
be
too. Yes, it
covered
could be
as an
covered.
employee benefit. Check with
Right.
your hospital, check with your employer. It's part, even 12 sessions with a medical social worker can make a huge difference. I have a friend who started working for big corporations, and she's talking to folks who are burned out. And I said, how you like it? And she said, man, they're so focused, and you can get a lot done in 12 sessions. You can help them figure out what's the issue, what can they control, what can they change, what factors can they not change. Now, if you're working for someone you hate, you're not going to change that, and maybe a different job is necessary. If you have a supervisor that is just a royal jerk, you may need to transfer into a different unit or a different NICU or a different area of the hospital. If you're having trouble with a particular coworker, y'all may have to sit down together with some sort of facilitator and work something out. But she told me that within 12 sessions, she helped lots of people target what they could control, what they could change. So much of what we do in healthcare, and we can't control. Sick children, electronic records, we all hate them.
Right.
How many clicks do you have to go through to get the x-ray, the lab, the chart, the this, the that? It's just torture. We're not going to be able to change that. We're just going to have to accept that and move on and target things we can change. Like, if you don't like your manager, you may need to go to a different unit because
Right.
that manager may be really stuck in stone there.
Right. And I think having someone kind of help you figure out what is changeable, what's not changeable, what's
Yes,
within your control, and sort of owning some of that yourself, like, oh, I can change that. I just haven't given myself permission to change
right.
that. So yeah, those are all good things.
Journaling for me was a big one. And I was surprised that it was so helpful. My therapist suggested it, and I said, no, I don't know. That's kind of loosey-goosey. And she said, no, you're so right-brained. I mean, you're so left-brained, right-handed, focus-oriented, procedure, critical care, doing things, do, perfection, achieving. That's right-handed stuff, left-brain stuff. She said, you never let your right brain say anything. I said, well, she said, part of burnout is when your right brain is not in touch with your feelings. And what journaling does is allows your right brain, your feeling brain, to take over and put something on paper about how you really feel or what the deal really is or what's really bothering you. And the more that I tried it, the more I discovered that it really did kind of shut down that doing left brain, and it let my feeling right brain be more expressed. There's one other thing I forgot as a technique for getting better, and that is playing music. I was lucky enough that I played piano as a young girl, and I played it poorly off and on as an adult, but I started taking piano lessons. And playing music, especially if you're not very good at it, is so immersive. Probably listening to music is just as good, especially if you love a certain type of music. We all know that when we listen to music, it makes us feel a certain mood. And certain music gives us certain feelings. Well, you can choose the music you want to listen to get better when you're burnout. If you love classical, go listen to classical. If you play the piano, sit down and play the piano. Because for the 1 hour that I would practice every day, I didn't think about work and burnout. I thought about those notes and the music and the sound. So again, that's right brain stuff.
Right.
Listening to music, journaling, that's all right brain stuff to give your right brain a chance to speak, if you will, feel feelings, be creative. Of course, hobbies are good things to do, but most of us that work full time leave our hobbies behind, unfortunately. But any hobby that you do, painting or sculpting or drawing or stitching, those things again allow your right brain to be creative.
Yeah, the tactile part, gardening, all those
Right.
things. I mean, I'm laughing because I have a dishwashing list that I created on Spotify, and so every time I wash dishes, I listen to this kind of music, or maybe it's music that you listen to in the car, like on your
Cool.
commute to work.
Right.
That
Right.
that those and my kids always laugh. They're like, "Oh, mom's listening to Spotify again." So you could be that nurse, that you could be the one that's listening to the Spotify list. But yeah,
Yes.
those are great. So what are some other, I think, solutions to giving people, I think, permission to just be a better NICU professional? I think that sometimes we either don't want to give ourselves permission, we worry that like maybe we won't be as good in our job, or that people won't respect us as much if we make some changes. So how do you sort of combat the negativity when you know that you're doing something healthy for yourself? How do you combat the negativity of some of those people who are maybe in the cynicism category, who may not be as encouraging of you as you try to figure out how can I be a better NICU professional?
For me, it meant talking with my supervisor, the medical director, and enlisting his help in a group meeting where we tried to come to consensus about a problem we were all dealing with. And I'm sure that NICU nurses and nurse practitioners can do this because nursing is very hierarchical, very structured. And if you have a manager who is willing to have some sessions about burnout and scheduling and stressors, that would be wonderful. And you could lead that session. You could do some research. You could talk about your own experience. You could get extra information. There are checklists. There are scales that are available for people to check off in 20 to 30 items, whether they are in fact burned out, all the different components of burnout. You could say, hey, what I'd like to do my project this year, my quality improvement project, is assess where the unit is and ask everybody to take this scale. And of course, it's anonymous. And then you look at it and you get the data and you come back and you say, well, 60% of us are just fine, but there's 30% of us that are pretty strung out and 10% that are really burned out. And here are the scores. And this is why it's important for us to talk about it. So it could be a quality improvement issue. Wellness is on the list of hospital administrators. I don't think it's high on the list, but it's on their list. They have been reading about all this burnout and talking about it. Some are willing to put some money behind it, like create a wellness champion, create a nurse or physician wellness champion, someone who knows the scales, knows how to get the scales, where to purchase some assessments, because some are for sale and some are free, and how to organize groups to talk about this. So I think there's lots of opportunity for people who want to make a difference besides just personally interacting with friends and colleagues. So I would encourage people to think about this as a quality improvement initiative, to think about this for clinical ladder, to think about this for, I know there are lots of different nursing designations for extra work that's not clinical. It really lends itself to that really easily, this whole topic of burnout.
Well, it's not going to go away because the demands of healthcare workers continue to rise. And
Mhm.
it's not that we're going to be able to fix it all in one fell swoop, but I do think that we can start to cut off the blood supply a little bit earlier and start to say, like, I think I see these things. Let's intervene quicker
Yes.
instead of letting it get to the end and then there's no hope for coming back from that. So I think that we are more self-aware ourselves, but also
Yeah.
more self-aware as a department, like where are people struggling and how can we intervene earlier.
Right.
So
And
I love
data
that.
really speaks loudly. I mean, having numbers, having your peers take a scale that takes 20 minutes to do, and having the numbers and looking at the data. Oh, or we're a really healthy unit. We're all doing just fine. And maybe changing something that somebody wants to do. Those things are very important and they're all very doable, especially now that hospital administrators and nurse managers have it on the back burner. They're going to let somebody in the unit take that ball and run with it. They really are. And I wish I had the strength to do that when I was burned out
Yeah.
right before I retired. But I was so burned out and I just needed to get better. It took me about a year to get better. Sometimes burnout takes a while to get better. And I guess it depends on the factors and the duration.
Right.
But for healthcare workers that are listening, you can make a difference in your workplace, for not only for yourself and your friends, but for the babies and parents that you take care of. You really
Right.
can make a difference.
I'm glad that you said that. I mean, we always hear the comment, like, when mom's happy, everyone's happy. I think
Yeah.
when you're in a NICU situation and you're a NICU professional is in a healthy place, is self-aware, who knows what he or she needs to do to be the best possible NICU professional, that can't help but be transferred to the patients and the other people that they work with, and that
Right.
when you're healthy, other people, you sort of raise the bar, like, this is where we are now, and we're gonna raise the bar that we don't
Right.
all have to be in this horrible place, but that we can all be in a better place and in effect, benefit our patients by being our best selves, when we're there.
Yeah.
I usually ask at the end, like, tell me, dream a little bit, which we kinda dreamed a little bit, but, like, what's one thing, Dr. Landers, that you think that we can do to encourage a better, healthier NICU environment for NICU professionals as they learn to integrate work with home?
The one thing we can all do is express our appreciation to our coworkers. If somebody does a good job, let them know. We all need to feel valued. We all need to feel fulfilled. And if you see somebody that's not looking like they feel good. Ask them what's going on. Be a friend. Provide a helping hand. I wanted to tell you one more anecdote because NICU nurses and parents are so special. After I retired and my burnout was, I had recovered and then I retired, I decided to write a book called So Many Babies. And that book was filled with NICU stories of patients I had taken care of in the previous 30 years. I called parents. I wrote emails to parents. I contacted people whose children were now 23, 24 years old. Every single parent I talked to, I said, I want to tell your NICU story. Can I tell your child's NICU story? Your family was really special. Your baby and you and your husband taught me this and illustrated how wonderful NICU healthcare is. Every single family I contacted said, oh, sure, tell our story. That's fine. We love it. We're so happy that we graduated from the NICU. None of them had had an easy time. These were difficult patients with difficult conditions, but every family said, sure, you have our permission to tell our story. And that was the basics for my book. Those NICU stories, those things I learned from NICU parents throughout the years were the beginning of what turned out to be a memoir. It's called So Many Babies. And I would love for your listeners to check it out. They may enjoy reading those stories. I know they will identify with lots of the families that I portray, with lots of my struggles in there as a working mom. I think that I write about burnout in there and how I had to recover from my burnout. I write about problems with some of my partners and issues at work and how we dealt with those. So I just put lots of good, helpful things in that book. Again, we're caring people. We want to take care of other people. We want to serve others. That's what we do. That's what nurses and doctors do. We care for others. And writing my book was my way of caring for other people, especially other NICU people.
Well, stories are really impactful. It's sometimes how we can articulate something that we've been through or that we can encourage someone. I mean, I think the reality is that we all have a story, and some people tell their stories to their friends and in private conversations, and some people tell their stories on stages or in printed publications. But the important part is to know is that the stories can be healing. Sharing your story can be healing, but it can also be such a cathartic thing. And I know when you were talking about journaling, all those abilities to, I think, share our experience. And I think our intrinsic nature as humans is we want to share our story for two reasons. One, because we believe it's an important story, but also because we really want to help other people navigate maybe something similar, that we have this desire to help people along the way. That if I learned from this or I went through this, maybe this will make your journey, your path a little bit less difficult and a lot more easy. So I'm grateful that you mentioned that. Dr. Landers, thank you for all your good information about burnout, what the stressors are, how we can identify it, but more importantly, how we can combat it and be better NICU professionals. So thank you for being here. Thanks, y'all, for listening to NICU Heroes. If you enjoyed today's episode, please don't be shy, y'all. You can share it, you can subscribe, and you can most certainly review it. We would love your reviews. It's how we reach more NICU professionals. I'll see y'all next time.